Kelso here for Michigan Country. I am interviewing Michelle, and I'm just going to throw it over to you. Michelle, tell us, first of all, your name and what happened that led us to this situation today.
Hi, I'm happy to be here. My name is Michelle Jarvie, and I was a laboratory scientist working at Lake Superior State University since 2021. And we are here today because I wanted to talk about our funding that got cut recently and the research and opportunities that have been lost in our communities.
Okay, so tell us about what you were doing.
Our lab was part of a Michigan wide network of research labs that was started in 2021 to sort of track COVID levels in various communities through wastewater. And so we had 16 sites across the eastern UP, ranging from Mackinac Island to Manistee, Munising, Sault Ste. Marie, all the little communities in between. And so we could track sort of the community levels in wastewater anonymously and without having to rely on clinical testing. Very useful to get true numbers of COVID in the community. As the pandemic sort of wore on, or some would say dwindled, we added other markers such as norovirus, influenza A and B. We were testing for avian influenza and RSV virus. And basically anything that the CDC wanted data about, we could test for through wastewater. Yeah, it is really fascinating. There's so many things you can test for in wastewater. The most interesting I always found was that you could look for arthritis in wastewater, and so you could see maybe
Interesting.
the level of painful joints in your community.
So you can learn a lot about what the community's needs are and maybe help support them in those needs is the theory, right?
Absolutely. Yeah, and we did a lot of research where we could even say how far in advance, let's say we get a positive in wastewater for COVID-19, we could actually predict in a certain number of days a spike in clinical cases that would show up. So it was actually a predictive nature. We could give that data to the health departments in the communities, and they could anticipate, oh, we're going to either have more hospital visits, more people coming in for testing and whatnot. So it was really an interesting project to work on.
Lots of information that's very helpful to the community.
Absolutely.
Was there a specific name for the program?
It was called the My Network, MI Network, or we were called the Sewer Lab. And so yeah, we were stated.
So how many people were working on this at LSSU and then in general?
So
Roughly.
there were always two full-time laboratory workers. So myself, I was on from the very beginning, and we had several others throughout the years, but always two of us in the lab. The last couple months, we added a third person full-time to the lab. So when we finished, there were three full-time workers. There were three project investigators that were professors at the university that did sort of all the administrating of the project. And then at any given time, we had between 3 and 6 student workers who were students at LSSU who were getting sort of on the site experience that they could put on their resume and hopefully get a better job once they graduate or get some different lab experience. So quite a few people were involved.
Wow, yeah. And then what happened?
Yeah. So we were just, going about our business. We had just recently started testing for avian influenza, which was sort of terrifying and very exciting for us lab geeks. And we had actually gotten a positive avian influenza test at a site in the eastern UP, and it kind of created a lot of buzz with our state level partners. And then all of a sudden, we were told one day that we had to go home because our funding had been clawed back by the federal administration as part of all of the clawing back of money through CDC and NIH. And we had actually worked a couple of days beyond when we were supposed to quit because we hadn't really gotten the correct information from anybody with authority And so officially on March 31st, we had to just walk away from our labs, shut everything down because we weren't going to get paid beyond March 1st. And so it was money that had already been distributed to the state DHHS. It wasn't like funding we were waiting to receive. We had already gotten it, but they clawed it back. So the projects were just suddenly done.
You had every reason to think the program was still going to keep going, and then it just out of nowhere.
Absolutely. And even for a week or two afterwards, our state level leadership wasn't sure what was going to happen, if it was just a temporary pause. And us as employees, we were kind of in limbo. Should I go look for a new job? Is this going to suddenly restart? What about all of our equipment and materials that are sort of sitting there rotting in freezers? What's going to happen? And we kind of just waited around for a little bit, and then it was decided that we weren't getting the money back. So we were officially released from the university. I went back in and sort of shut down all of our machines and tried to consolidate our materials that are sensitive to time and temperature and just put them all in one place and said, well, if somebody wants to use these someday, then they can. Otherwise, someone will probably be throwing them out in a couple of years or so. So yeah, we had the project for us. Each site had a different amount of funding, but we brought in about just under $1 million a year to Lake Superior State University. That covered employment, but also several robotic precision machines and all of our consumables that we went through. And so it really was a big deal to a small university to bring in employees and that much money for research. Those were machines and materials that students and other professors could use. We were the only site that had our own in-house genome sequencing equipment so that we could identify different COVID-19 variants, but it could also be used for identifying bacteria, basically anything that has a genome sequenced. And so I had been working with several students on various senior projects in our lab using our equipment. And so now, while the equipment is still there aren't any longer any experts there to help people out with using the equipment. And then the other thing is that the project paid for all of the servicing of the machines. So they're great precision machines, but they do break more frequently than you want them to.
They're machines.
Yeah, they're machines. If they're off by just a tiny millimeter, they don't work properly. So now we still have the machines that other people can use, but if they break, the university has to pay for it. And most small universities don't have the money to pay for a repair person to come out from Chicago and spend 2 days working on a machine. So while we still have them, they may not be serviceable anymore as well. I mean, some people, they can learn how to use them, but really, like, I've been there for 4 years. I kind of know the machines like they're parts of my family, and not everybody in the building knows how to use them. There they sit.
So now they're just going to kind of sit there and be, not helpful.
Yeah.
What are some direct benefits to the community that are now lost? Kind of hinted at that, but how is this going to affect our community?
Yeah, so along with just our one lab at Lake State, we also have this whole network across the state, and we could talk to each other about what was going on in different communities and what we were seeing. And being up in the UP, if we look back to the COVID times, shall we say, things got here a little more slowly than they did everywhere else. So when we were switching between just the first COVID, the original COVID, and then passing through Delta variant, which was super devastating. That didn't reach the UP until it kind of moved its way up the state. So we got that information. You could see where it was moving based on travel and seasonality of tourists and things. Mackinac Island was a really important site, not only because a lot of the state dignitaries have meetings there during the summer and don't want to come to the island and catch and spread COVID, but it's also a big tourist site. So we could really see the difference between how tourism affects the different variants and diseases being brought to the area compared to other smaller places that didn't have as much tourism. So that was one thing we noticed. It was also we communicated our results directly to the health departments of the counties that we tested from, and one of the things that they mentioned was really important was when we started testing for the variants, so that they could know each variant kind of had its own set of symptoms that came along with it. So if they started to see more of those symptoms, they could kind of guess what variant it was, but we could test for it and actually tell them, well, this is kind of what's circulating right now. So you can expect to see more respiratory hospitalizations, or as we moved on to, say, Omicron, there would be fewer hospitalizations and things like that. So just basic community knowledge. And then more recently, we had made a website where we posted all of our results and could give sort of a graph each week of, okay, norovirus is really high right now, so you may want to do some extra hand washing with your kids when they come home from school. And actually, a lot of people from the community really relied on that week to week to make decisions about whether they wanted to go to a public event or if they thought they should stay home. If they were feeling sick, could it just be influenza, or is COVID really high again? Should I go get tested, and things like that. So there was a pretty big community effect.
So how did you communicate the information to the community?
So we created a website. We had a website that sort of highlighted our lab capabilities, and then we just made an extra page on there where I would include the actual data and then graphs for each of the viruses that we're testing for. And then I would, of course, put it on like my personal social media each week as well. And then all of the information could go to the health departments, and so people could also call their health department if they wanted more information.
So what do you think is the biggest loss of having this just closed down? There's a lot of them, I'm sure. What would be the biggest loss? Or just some of the losses?
Yeah, I would say there's two really important ones. One is that now nobody knows what's happening in their community, right? We have no knowledge of what viruses are out there, especially at the time we shut down right when avian influenza was starting to infiltrate humans, shall we say. And there was a lot of fear around that. And because we had a positive, our state level partners were really surprised. They're like, really? In the UP? But what they didn't realize was that we're a major bird migration area, and the site that we had the positive was right on the Mackinac Straits, where all the birds sort of cross over the lake and then maybe spend the night either on land or near shore. So it wasn't actually surprising to us that we had a positive there. But now we don't know any of that. We don't know how much it is crossing over into people. We were going to start offering testing for local flocks or anyone who thought that they may have avian influenza in their chickens. And so now all of that knowledge is sort of gone. We're going blind, right? And a lot of people don't care about that, but a lot of people do. So I think it's important that if the community has the information available, it's their choice whether they want to seek it out and use it or not. And now they don't have that choice. It's just not there. And we're seeing that sort of nationwide. I've read a lot of articles that even the CDC has been suppressed, where they're not telling us anything about sort of nationwide disease trends or foodborne illness outbreaks and all of these things. It should be our choice whether we want to access the information, but it should be there if we want to. So that's one big thing. The other thing I think is the loss to the university students. I don't even know the number of students that sort of either worked in our lab on our project, or how many senior projects were designed based on the capabilities of our laboratory. I worked with students who studied avian influenza in local ducks to see sort of what the levels of the different avian influenza strains were in ducks. I've worked with students on looking for Lyme disease in ticks that were collected from various parts of the state. So just a lot of different opportunities for students to use equipment and learn skills that would benefit them in the future. And now that may be lost because there isn't anyone there to help them through the protocols and using the equipment. So now there's just that loss of knowledge.
So what happens to the students' projects that they had started and now they can't finish? Do they have to recreate a new project, or what?
For the most part, at the time we finished, the students that were working in there had completed their projects. I know there are a couple that were looking for drugs, illicit drugs and wastewater, and they were going to collect throughout the summer. And so, yeah, they will have to find a new project and design something different to work on, because we're not collecting the wastewater anymore with our partners, and so it's just not possible anymore. So we'll have to redesign.
That's unfortunate for them, and unfortunate. It sounds like an important study too.
Yeah,
didn't get to be done. So, anything else that you want to mention about the project or your feelings about being shut down?
It was really hard for us. We were attached to the project and we knew it would probably end at some point, but in a more toned down, let's wind it down. We're going to decommission things slowly, or maybe we're going to switch to testing for different targets based on whatever new diseases are up and coming. I think we built this infrastructure across the state, and actually our state was used as a model for other states to bring on wastewater based epidemiology, because it's pretty easy and it's pretty accurate. And so we served as a model, and basically now as a state we have the equipment and the personnel trained to test for anything that comes along. When monkeypox was kind of a thing, we were ready in a heartbeat. As soon as the testing solutions were available, we had everything to do it. Same with avian influenza. We had all the equipment and the knowledge to do it across the entire state, so that anytime anything like COVID happens again, we're ready immediately for it. There will be another pandemic, there will be another outbreak of something. And now again, we've gone back to sort of zero, where we've got to rebuild that structure because all of these machines are going to age or be redistributed to other places. And so I think from sort of a humanity standpoint, it's been a disservice to the people to take away our ability to be ready for anything at any time, because if COVID can happen, anything can happen.
So say we've all learned things can happen. You never know when, and having the equipment and being ready is important. And yeah, how across the whole state, how many facilities were working on this?
Yeah, so originally there were 19 different labs working on this, a lot of them at universities, some with private water testing organizations. But yeah, originally there were 19, so quite a large group. And I don't even know how many people that entailed. We were a small operation, but other universities had multiple labs with several grad students as well as project investigators. So a lot of people across the state.
And then the government just said, stop.
Another sort of side downfall is that we also, every summer, we test for E. coli on beaches to determine whether swimming beaches need to be shut down for body contact because there's too much E. coli in the water. And so sort of inadvertently, that testing was also affected because the same people and lab equipment that were used to test the beaches are now not employed by the university because we were the same people doing the same testing. And so now that program is kind of hurting as well because we don't have the money to employ students to go pick up the samples. And then I and my counterpart who did the laboratory work are also not there anymore. So sort of multifaceted.
So just another case of knowledge that we don't have because of this
Yeah.
now. It's just crazy. I guess that kind of covers things, unless there's anything else you wanted to talk about with this.
I I would say good luck out there, everybody. Wash your hands, because just because you're not hearing about these things anymore doesn't mean that they don't exist. You know, COVID is still out there. We saw some of our highest COVID numbers in wastewater in the last 9 months. And so it's still around. It's still making people sick. We've got avian influenza that we're not even sure about yet. We don't know everything about it. So stay safe. And if you feel like your community has lost out on this information, then reach out to your representatives and complain about it. If they don't hear about it, they don't think about it.
Yep, exactly. Well, thank you so much for taking the time to talk to me about this important subject. We'll make sure to get it out to the people and hopefully at least let people know what's happening.
All right, thank you so much.